Alright, so right now we're using the Vbeam Perfecta laser. This guy right over here, it's the newer generation of the Vbeam. The older one didn't have super high power. This one has a lot higher power, so you can go a bigger diameter pulse size, and you can actually get deeper into the skin when you do that with a pulse dye laser. Right now we're treating rosacea, so you can see all the way across the skin over here. If you look at the green light, you'll see all these little vessels under the skin. You see that?
Yes.
Alright, so you see those vessels under the skin, they're red, so we're going to be lasering these like that, and it closes off the vessels. When you're doing the Vbeam, which is a pulse dye laser, on I'd say more delicate skin and just for rosacea, you tend to go a little bit weaker on the energy. You don't need a super high energy, and you're not trying to get something called intravascular coagulation. When you're doing a port wine stain, which is a type of blood vessel or capillary malformation under the skin, you do want to get that intravascular coagulation to get better clearance of it, but you get more of a downtime. So this is going to turn her reddish purple, usually for a little bit less than a week. If we were to go high power, then you would imagine it would probably stay around for 2 weeks. And for rosacea, it would increase your chance of it happening again. So for rosacea, this is a nice treatment to do, but it's not the only treatment. Sunblock is number one. That's what's going to keep the stuff from acting up on most people. Decrease alcohol intake for a lot of people. Gets rid of the underlying factor. And the others, you have to decide if they have telangiectatic rosacea, which is what this is, so it's smooth skin rosacea, or if they have papulopustular rosacea, which is more like acne type skin, and there's usually some sort of underlying bacterial overgrowth, or your flora is a little bit off, and it could be off from yeast or bacteria. So those patients, we like to put them on different compounds. We have Midwest Pharmacy actually making us a bunch of compounds for patients that have azelaic acid in it and different medications based upon what they need for acne, for rosacea, for anything. So we're going to come on the nose to get these little blood vessels. Alright, and when it's on low power like this, it doesn't hurt as much, but obviously it's still sensitive in some areas. It's good to know that these are not permanent treatments. Blood vessels, once they're on your face, they're there because your face wants them to be there, so they tend to grow back at some point. If that happens, you just end up lasering again. For some people that's a year, for some people that's 6 months. And in between, you always need to make sure they're on sunblock, which is typically an SPF 50 is what would keep your skin calm. Alright, so we're going to set this on there. Out of cryogen. Alright. So that's the end of our laser for now. We're going to replace the cryogen, keep torching our front here.